When there is chest pain, often an angiogram is done to check if there are blocks in the blood vessels of the heart. Stent, which are usually metallic tube mesh structures, are put to increase the flow, and if that is not feasible, do a bypass surgery. That is a no. Often simultaneously, the current modern medical protocol is to take lifelong medication to control hypertension, diabetes, cholesterol, etc., which are believed to contribute to deposits in the blood vessels and development of blocks. In spite of regularly taking medications, many continue to develop symptoms and require repeat angioplasty and bypass surgery. Why is it that in spite of all the developments in modern medicine, these health challenges are recurring again and again? We can take the case of a heart patient. The first heart attack took place 4 years ago in July 2021. After the first heart attack, angioplasty was done and a stent was put. In 1923, the patient again developed chest pain and discomfort. Angiography was done and advised to undergo bypass surgery. CABG, coronary artery bypass graft, was done in May 2023. Within 3 months of the operation, the patient again developed chest pain and discomfort. Repeat angiogram and angioplasty was done in July 2023 and 2 more stents were put. When chest pain and discomfort continued, in November 2023, 5th month after bypass surgery, the patient had a second angiogram and balloon angioplasty. In spite of all these cardiac interventions and taking 12 medicines regularly at different times of the day, the discomfort continued and another bypass surgery was advised. Let us see what happens when this patient on multiple medication who had undergone a bypass surgery and 3 angioplasties and was advised another bypass surgery within 6 months undergoes, and what happened when clinically supported lifestyle correction started. How surgeries can be avoided, how long it took for the symptoms to disappear, how long it took to taper off and stop multiple medications for cardiovascular disease, diabetes, hypertension, cholesterol and thyroid problems, etc. What is the crucial importance of lab tests in evaluating improvements in body parameters, which helps in reducing and stopping medications? Most importantly, the time it took to bring blood pressure, cholesterol, thyroid function test, HbA1c, glucose levels, etc. to normal levels without the need for medication or surgery. This series is about my experience with patients who took clinically supported lifestyle correction to avoid surgery and taper off medications. This can help you understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on undergoing surgical procedures or continuing with lifelong medication. To know more about different lifestyle diseases, treatment options, reversal of lifestyle diseases with lifestyle modulation, etc., you may search our YouTube healthcare channel. When we come to the details of the patient, this is a 55-year-old lady, height 154 centimeters and weight 62.5 kg. When we come to the medical history, the problem started around 4 years back, and she had a chest pain and went to the hospital. And generally, in most of the cardiology unit, when you are going to the hospital, they will check the ECG and troponin test. And if there is elevation problem, they will usually, the current norm is primary angioplasty, and immediately do an angiogram and put if there is a block, put the stent. That is the usual procedures, and she also undergone through that procedure. And for the next 2 years, there was not much problem. But in 2023, again she had developed chest pain. And after this putting the stent, she has been, at that time she was diagnosed with hypertension and dyslipidemia, that is cholesterol and triglyceride were high. And she was put on medication from that point onwards. And last month again she was diagnosed with thyroiditis also, that hypothyroidism, Hashimoto's thyroiditis. And for that also medication has started. Currently her problem is she is having discomfort with the chest. She is not able to walk, not able to do any household work, or it is very difficult for her to take bath also. Because of the chest discomfort, she is not able to do anything. And also there is discoloration of the face and hand, etc. is there. Next, when we come to the surgical history or her cardiac interventions, in July 2021, the first angioplasty was done and one stent was put. And then in May 2023, just before second year completion, she had again chest pain and gone to the hospital. This time angiogram was done and advised a bypass surgery is needed. It was done in May 2023. And after the surgery, within 2-3 months, her discomfort was recurring. And in July 2023, again angiogram was done and angioplasty along with the 2 more stent is applied. That is also again with the severe pain. She was taken to the hospital and the primary angioplasty was done. And again in November, she had been again admitted with the hospital. And that time they had done a balloon angioplasty. Actually, there is more blouse and maybe dilatation was done. Actually, balloon angioplasty means just you are getting into the, actually through the artery, you are getting into the small thing and going into the heart. And with the entering into the coronary artery, and this balloon, the catheter will be having a balloon and it will be dilated at the this blocking points. But we can imagine, if it is a fat, it is only for some time. When it is pressed, it will be moving. But after, when you take it out, it will again come off. Just that bulge will come. It is this atherosclerosis means this bulges. Actually, some bulges are coming. This some small hills in the blood vessels, and that is fat because it is a soft tissue. When it is pressed, it will move. But if the pressure is taken away, it will come back. But in the stent, when you are applying, you are applying a steel mesh because when it is pressed, it will keep off that fat for the time being. But the problem is that it's a foreign body, and blood clots can occur in that, and the block can happen. And also even the blood vessels can become narrowed down because of the inflammatory process, because of the foreign body. That is why this to prevent the clot, after putting the stent, you had to take at least for an year. Blood thinners is needed. Let's see, doing a repeat bypass surgery within 6 months after the first, it will be very difficult because doing a bypass surgery itself is an open, chest wall has to be opened. You have the major, very strong bone at the middle of the chest that is called a sternum. Into that, these ribs are inserted. And it has to be cut with strong electrical cutters, like which is cutting the tile or strong things. And you have to separate the chest wall with the separators and getting into the heart, and there will be a cardiac pericardium, there is a membrane is there in the heart, and it has to be cut open, and then we will be seeing the blood vessels and doing the bypass. You are grafting some, you may have to take a blood vessel from the leg. Usually it is a venous vein of the leg is harvested and connected with the aorta and the blocked area. After the blocked area, you won't be, when you are open, you cannot see which is part is the block, or it cannot be exactly. Only with the previous angiogram, you are understanding some block may be which area, and accordingly it will be put. So she had already a surgery within the 6 months. And when in closing also, usually we'll be using this different sort of stitching material. In this is a bone structure. It is very important. If you make a cough or any fast chest movement, it should not burst open. So the closing is done with the steel wires actually. So opening this, not, I'm not talking about the skin stitches. Skin stitches you can apply the cotton or cotton. Usually cotton or absorbable stitches can be used on the skin of the this bypass surgery wound. But internally, the bone is closed with the steel wires. So it is opening it again after within 6 months. The healing of the bone itself is not complete by the time. So it can create so many problems actually. So the patient also may be not willing, because it's a very painful after the operation. So much of pain will be there. Most of the patients will be suffering. Many of the complications of wound healing and all. So she was not willing for undergoing one more surgery. That's why she planned of the clinically supported lifestyle correction actually. And we'll see what was her situation when we started, because we are assessing the patient initially in detail, then only we will be starting the clinically supported lifestyle correction. And when we take the symptoms, her major symptom was the chest discomfort and difficulty in walking or bending. She's not able to do any work, even the bathing or the household work, nothing she was able to do. And there is discoloration of the hand and the face also. And when we come to the medications, she's taking aspirin and ticagrelor. That is, both of them are blood thinners. Second tablet is taken morning and evening. The other is once, 3 tablets. And to avoid the side effects, especially this gastric side effects and acidity, she has given 2 tablets medications, domperidone and esomeprazole. So she is taking that 5 tablets for that alone. And rosuvastatin for the blood thin, that is cholesterol, for the cholesterol. Nitroglycerin, nicorandil and trimetazidine is mainly for the heart. It is dilating the blood vessels. Actually, when you are dilating the blood vessels, that will slightly more open, and blood pressure also will be reduced. So it will be making the heart easier, to less strainful to pump. And metoprolol is another beta blocker that will reduce the blood pressure and also reduce the heartbeat. Usually when you are doing some activity or when you are angry, your pulse rate will increase. No? So this natural, to block that natural reaction itself, this medicine will reduce the natural heart increase and the heart activity. It is actually blocking the increased cardiac activity as a protective measure. Then she has been given spironolactone, that is actually a diuretic with potassium sparing, and furosemide. I don't know why. Usually I am not against, usually in the prescriptions of the post-cardiac patients, it is not seen. Only for the patients who is with the cardiac failure. But she was not having, I didn't see any of the cardiac failure symptoms, even with the ultrasound scan, the echocardiograph also he had taken. But that was not showing any signs of cardiac failure, but she has been given that 2 tablets also. That is some effect on the reducing BP also. Then thyroxine, that is Hashimoto, she is having Hashimoto thyroiditis, and thyroxine is the hormone replacement for the thyroid. That was the medicines she was taking. And so many tablets, many of the tablets are taking almost 12 tablets, type of medication, and many are taken twice a day. So you can imagine almost so many tablets, around 20 tablets or so, maybe more. And when we come to the blood test, she was not diagnosed with the diabetes before, but now her HbA1c is 6.4, and glucose level normal 95. So she is almost in the diabetic, pre-diabetes. It is actually going to be diabetic. 6.4 is the margin between both pre-diabetes and diabetes. And her insulin level is so high. She is not even on any diabetic medication. Then also her insulin is 150. The maximum is supposed to be around 24 or 25. So it is so high insulin level. And C-peptide also, it's another marker of the diabetes. That is also very high. But amylase and lipase, that is an additional pancreatic marker, they are okay. The cholesterol is low because the statin she is taking. That is because it will the cholesterol is synthesized by the body, and the statin is blocking the synthesis of the cholesterol. So you will be able to control the cholesterol, but you are not able to control with the medicine like a statin. But you will not be able to control triglyceride level. She is taking very high dose of statin, but her triglyceride is 313. You can control the triglyceride only by modulating your food. Only dietary measures can reduce the triglyceride. And also HDL level is very low. That also you can correct it only through the dietary restrictions. You cannot increase the STL level much with the medication. Then troponin level, that is actually the cardiac marker, but that is normal. Her troponin is normal, but her kidney marker, that is kidney function is low. As a grade 2 renal failure is there. 70, GFR is 70, it should be more than 100. Because she has undergone so many angiogram and angioplasty, that contrast which is used for this, it is a renal toxin actually. It can, contrast nephropathy can occur. So maybe because of that her renal function is affected. And vitamin D is low, and the cardiac marker, another cardiac marker, HSCRP and CRP, inflammatory markers, those HSCRP is normal. But ESR, another inflammatory marker, is very high, 95 is there. And in spite of hormone replacement therapy for the thyroid, her TSH is high. But other autoimmune markers for the thyroid is okay. This is the situation of the patient. And the final diagnosis, when you come to the diagnosis, she's having CAD, that is coronary artery disease is there, dyslipidemia, hypertension, Hashimoto thyroiditis, and hyperinsulinemia. You will not, in the modern medicine, or the other doctors, you won't see the diagnosis is hyperinsulinemia. No one is looking into the, everyone look for the thyroid, TFT, T3, T4, everything you look for. But in modern medicine also, no one is looking for the insulin level. Why? Because 90 to 95% of the diabetic patients are type 2 diabetes. And almost all these patients who is on type 2 diabetes, insulin and medication for the type 2 diabetes, because it is increasing the insulin there, they'll be all hyperinsulinemic. If you are finding out hyperthyroidism and T4 or T3 is very high, you will knock out the gland itself, either with the iodine. There are medication, most of the doctors will not stick to this Mercosol and some medicines are there. But most doctors will advise for knocking out with the radiation or with the surgical removal. But with the pancreas and the hyperinsulinemia, the approach is different. I can't understand why modern medicine doctors and the endocrinologists have not bothered about the hyperinsulinemia. Anyway, in the clinically supported lifestyle correction, we take hyperinsulinemia is very bad anyway, and there is no medication to reduce hyperinsulinemia. But if you can do the lifestyle correction, you can definitely correct it. Maybe because of that, we don't modern medicine, the doctors, and even myself, I am a modern medicine doctor, and we don't have any medicine. Modern medicine means we think about only the medicine generally. But the primary mode of treatment is always lifestyle correction. Now, how to correct the lifestyle? That is actually, if you look into all these treatment schedules, even you can look any treatment, NIH or the major hospitals like Mayo Clinic or national hospitals and all, the first line of treatment is lifestyle modulation, food control and exercise. But when they come to the modern medical part, the doctors, that has to be done by the patient. The medical part is medication or surgery. So we are thinking only in terms of that and what we can do with the medicine. The hyperinsulinemia cannot be treated with the medication, any medicine. That may be the reason no one is bothered about it. Anyway, for this patient, our major problem is when we come to the disease category, it is metabolic syndrome and autoimmune disease. And she had undergone 3 angioplasties and one in 2021 July angioplasty, 1 stent, May 2023 bypass surgery, July 2023 angioplasty and 2 stent, November 2023 balloon angioplasty, and December 2023 advised to repeat bypass surgery. So that is the situation. So this patient had so much of cardiac interventions, but her problem is remaining. Then for this patient, what we can do with the clinically supported lifestyle correction? So in clinically supported lifestyle correction, we are ensuring optimal nutrition and optimal activity and reduce the toxin level. We consider even the medication as a toxin. So we are giving primary importance to come out of medication, but making sure that all the parameters are keeping normal. For this patient, her BP, she's taking so many medications for BP and heart problem and all. As far as patient is concerned, only her pain. But the medication is for so many items. If it is, her type 2 diabetes is there, but she's not taking any medicine. And if someone is taking medicine also for the diabetes, like we'll see patients 3-4 tablets and insulin 3 or 4 times. Such patients also, if it is a type 2 diabetes, that means the insulin level and the C-peptide level is normal. We stop all the diabetic medication in the initial first day itself. But we check all the diabetic patients, we check monitor the blood sugar 4 times a day, or those who have this continuous monitoring facility, they are asked to follow the continuous monitoring or 4 times a day to make sure that after stopping all this insulin and medication, the patient is worried and the doctors are also worried whether the patient is following the correct instructions. It's only by checking we can see the patient themselves can be confident about their treatment. So we'll be checking like that, and also 4 times BP will be checked at home itself. And it is not, we are not admitting the patient at all. We can actually, it is a training course to make them understand how they can manage their own health and manage the lifestyle according to the health issues. So then this hypertension medicines, when the patient, the BP is reduced, accordingly they will be given instructions to reduce one by one medication. That is known. Usually, if the patient is following very well, everything is continuing, the medications can be, BP medicine also can be reduced very fast. And for the cholesterol and the statin and all, every week we will be checking the cholesterol level and reducing the dose. And likewise, any medication you will be reduced accordingly. Only thing, psychiatric medicines very slowly. Most of the other medicines very fast we can reduce. Or the clinical is about a lifestyle correction. What is the diagnosis is not that important actually. It's important, but because of the patients and the satisfaction, we should see the changes. But the most important, whatever single patient will be having 3 or 10 diseases, because diabetes, hypertension, heart disease, arthritis, thyroid. This patient is so many diseases. So what we are concentrating not on the problems actually. Only the correction, what is the level of correction and what is the changes which is happening to the patient. We'll see what are the changes which has happened for the patient. See the chest discomfort, that was the major problem. On the 8th day, by 8th day, the patient is saying almost she is free, there is no pain at all. But when we consider it is at least 90, the 8th day it's 100%, we can take it. So patient was so relieved of the pain. And also the difficulties while walking and bending and all, it was over basically. Discoloration, and she herself was feeling there is marked difference with the her changes is there for her color changes also. And by walking difficulty, it is by 30 days it's completely she is symptom free. When the discoloration by 90 days are changed, this discoloration of the face and is gone actually. And what about the medications actually? This aspirin, ticagrelor, that is 2 blood thinners. She has put her stent in July 2023. So she has to continue both of that medicines till next July 2024. So that, or maybe by 9th month or 3 months, we can reduce it to 1. These 2 are taking 3 tablets, and by the 12 months it can be taken. And this domperidone and omeprazole also she has to continue through till they are taking this blood thinners. So that 4 tablets you cannot stop till July 2024. And rosuvastatin was, there is a statin because her, even the triglyceride is high, her cholesterol was low, so it is reduced, and by 30th day it is stopped. And even after stopping, it was we are checking. After stopping, also we'll be checking the cholesterol and all the lipid parameters and making sure that it is maintained. Then this nitroglycerin, nicorandil, and trimetazolidine, all this it is gradually reduced by the 15th day itself. It is over because the patient doesn't have any pain from the 8th day. Then she herself is taking. Why should I take? So patient is so confident to stop the medicines. And metoprolol, that is also reduced by 30th day because that is to reduce the heartbeat and all. No? So that also reduced, and asked to take, if she is having palpitation or any tension or anything, she can take SOS half tablet if needed. She is taking 1 tablet morning and evening. That is reduced SOS. And spironolactone and furosemide, it is stopped about the first week itself actually. By 8th day it is over. And thyroxine also, she is taking thyroid medicine, and by the 30th day that is also over, but her even with the medicine her TSH was high. Without medicine her TSH came down to normal by the 30th day. Next, what was the improvements in the blood reports actually? This HbA1c was 6.4, it reduced to 8 and 5.9 and 5.4 by the 30th day. So it is maintained, 180 days also it was maintaining as 5.4. The glucose, because it was normal, we were not, actually the patient is checking at home, so we are not looking into every visits. Actually 180 day also 109 had HbA1c, glucose level. Insulin was so high, 115, and it is reduced to 11.4 by the 8th day. First week itself, hyperinsulinemia is gone. And the symptoms is gone and hyperinsulinemia is gone. So see the different, the relationship between the two. And we are saying it, for many patients we are saying it. And for those who are having hyperinsulinemia and with the correct nutrition and things, it will be corrected within the week itself actually. And this cholesterol was, without medication, cholesterol was maintaining normal. And triglyceride, it was high, it was not controlled with the medication, but it is reduced without medication to normal. And STL was low with the medication, but after stopping the statin and all, it is gradually took some time, but it is by 180 days it has come to normal. And this patient, but most of the patients the STL levels rise very fast, but this patient it took long time for STL to come to normal. The troponin level, that is the cardiac marker, it was maintaining normal. And GFR, the kidney, she was grade 2 renal failure was there. By the 30th day, that the GFR is it was 70 initially, it is increased to 103, and day 180 also is 99, it is normal. And vitamin D, definitely we gave supplements and it is got corrected. And even inflammatory marker ESR was high, and that also got corrected gradually. It was also took some time, but it was a gradual correction for the ESR, that is inflammation is reducing. That is, inflammation will be high when we are taking these toxins in the general air and water pollution in the food. All the toxins are you are eating, and also the patient was taking so many tablets also, that also is considered as toxin only for the body. It is not essential thing, no? So this and also excess fat in her body. So this, when it is all this is removed, that inflammation level also came down. This ESR is a marker of inflammation. Then TSH, her TSH was high even with the hormone replacement, levothyroxine, but it is reduced. But it is TSH level came down to normal. And when her echocardiogram also, actually initially there was some. It is written with the report, hypokinesis of the distal IVS apex, that the heart, that the tip of the heart was not moving properly, and also some trivial MR and mild TR or such things was there. But anyway, such problems was also, this hypokinesis was over by 180 days. Actually, we repeated on the day 90 and 180. She didn't repeat it on the day 90. But 180, it was her cardiac problems was also, this echocardiogram problem was over. And we usually do a CIMT test also. But the initial CIMT also, there was no atherosclerotic plaques was there. Usually the cardiac patient, what we see is, especially those with high calcium score, the CT angiogram showing calcium score, and even those with the triple vessel or disease and all. Usually this carotid artery, the neck, there is a major vessel going to the brain. No? In that there will be plaques will be there. But this patient, there was not much plaques. So most probably it may not be, I doubt whether her problem was of atherosclerosis alone. Maybe this angioplasty and angiogram and all, the blood vessels may appear shrunken or blocked because of the spasm. When you are injecting this dye, it can create a spasm there that can be mistaken for the block also. It may be because if there is no CIMT, there is no atherosclerosis, it is very unlikely to have major blocks in the heart. Anyway, she didn't get any benefit out of this bypass and so many stent and bypass also. That also shows that maybe her problem was something else. And then we come to the body parameters. Her weight, that is very important in this clinical, is about a lifestyle correction. What we see that if the patient is overweight, the reduction in the fat level, that is the most important thing, and it is showing that the patient is responding or not. Her weight was, when we are starting, it was 62.5, and by 6 months it was reduced to 49.6. By day 90 itself, it's come down to 54.8. So that reduction is very important, and her BMI was 26.4 and reduced to, by day 90 reduced to 23, and 180 20.9. And the BP was continuously, because she was initially she was on so many medicines to reduce BP, but now without medicine her BP is very normal. And the abdominal circumference, she had abdominal obesity, her abdominal circumference was 100 and it is reduced to 78. And body age, she had accelerated body age 65, she has real age is only 55, body age was 65, and it gradually reduced to 58 by day 90, by 54 by 180. So initially she was 10 years accelerated aging, now she is 54, she is really 55, now it is less than what her real calendar age. And fat percentage was 39.8 initially and came down to 35.6. It is very difficult to reduce the fat level actually. So what is ideal for her? For the future, what you are planning is for her to be the best in health. Keep her body weight around 45 and BMI 18 to 20, and BP definitely it will keep maintain. If the other things are okay, the BP will be okay. And abdominal circumference, ideally she should be less than 70. Ideally it should be around 60-65, at least keeping for the correct shape for the ladies. But keeping less than 70 is fine for the health. And body age less than, it's always keep for minimum 5 years less than what really are. Body age should be kept less than the calendar age. That is real health. That is real anti-aging treatment itself. Basically this clinical is about a treatment. For this diseases itself is an anti-aging treatment also. And fat percentage, it's ideally for the ladies below 15 to 25 is ideal, but at this age at least keep below 30, because already 40 it will be very difficult to go to 25 and all, but keeping below 30 will be fine for health aspects. Then when we glance into the before and after, that is very important for this lifestyle correction and obesity correction and all. No? So when we just take it before, she was symptomatic and going for another to reduce the symptoms, she was advised to undergo one more bypass surgery with the 6 months apart, and within a week, without any surgery, only by doing lifestyle correction, she is able to come out of the symptoms within a week. And for the medication part, actually by 30 days, many medications is over within a week. By 30 days, all the medications are over except the blood thinness, which has to be taken to protect her from getting clots and heart. Because of the clot, heart attack or stroke, she has to continue that for a year. So otherwise, her medicines are over. But by the time she came for the 180 day, her 1 year is over. So she was by the Next month itself, she was able to taper off all the blood thinners also and doing fine. Next, all the blood parameters came down to normal by 90 days itself. She was diabetic, HbA1c, even insulin level within a week it was got corrected. So all the blood parameters has come down. Even her insulin level was high, and with the medication, her triglyceride was very high, kidney function was low, and TSH, even with the hormone replacement, TSH was high. But all the blood parameters came down to normal within 30 days, and it is maintaining as normal and 180 day also. So that is the difference between the medication and the lifestyle correction. Then the body parameters, she has overweight, now she is in perfect health and body shape also. This protruding tummy is gone. And of course, it is we always encourage the people to get corrected, because physically there's a disease point of she's symptom free and she's happy. But it is always better to be in shape, especially ladies or even gents. Everyone should be healthy and keep the body age below at least 5 years at least below the calendar age. That is what we are encouraging the patients. And many are able to achieve 10 years younger than what they are, especially those who are 70 and 75 and all. Is actually they're able to keep 55 body age, 55 and 60 and all. That's very gratifying for the professional. Then when we look into if she is not coming for this lifestyle correction, what would have been her future actually? Yes, definitely she has to undergo a bypass surgery too, but she's not, I'm sure, I don't think that she's getting benefit out of one more bypass surgery. But after that bypass surgery, definitely she may have to be, now diabetes is diagnosed, she has to take diabetic medication, and again the problems will be increasing, and the hyperinsulinemia will be increasing. I think her major problem will be, all these problems will be related to the hyperinsulinemia may be making a major part of the problem actually. So if she is continuing with this conventional method of treating with the medicines and the surgeries, she'll be definitely increasing weight, and she'll be adding medicines for the diabetes, hypertension, and all the sort of medicines, and other comorbidities. When the weight will be increasing, and she may get arthritis, osteoarthritis, rheumatoid arthritis, because already one autoimmune disease is there. So basically other autoimmune disease, and even the cancer, possibility of getting the cancer, because hyperinsulinemia itself is a cancer producing, because it will when the insulin is high, this phagocytosis, when the cells, the immune system will catch all the abnormal cells, these cancer cells. Every minute, every seconds, there will be abnormal cells like a cancerous cells with cancerous change will be produced. Especially when there is so much of toxins and nutritional deficiency, it's inevitable to have abnormal cells which is produced, and it has to be removed by the immune system. When the insulin level is high, this phagocytosis, that is removal part of the immune system, will not function. That is the reason these diabetic patients and these hyperinsulinemia patients, the chance of cancer also will be high. Moreover, when you are on a medication, you are a complex patient. If you get an infection or an injury, you become a complex patient, and it will be very difficult to treat. So every time if you are put into a challenge, the chance of getting complications will be high. Like we all know, during COVID seasons, those who are diabetic or those who are on medication for the heart disease are the one more seriously affected. And the mortality was also, the complications was high in those sort of patients. Here, in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, cancer, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, etc. come under the umbrella of lifestyle diseases. 90% of the medication and 90% of the surgeries are for lifestyle diseases. This means that 90% of medicines and 90% of surgeries can be avoided. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication nor surgery that created the disease. This is why once medication is started, very often both the disease and medicines will keep on adding more numbers along with the unwanted side effects. This is why it's very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I'm Dr. Jolly Thomson, started medical education in Government Medical College, Kochi as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine and surgery, joined government service. Later resigned from government service and in 1997 started practicing as consultant at Life Care Center, Tapering, Kochi, focusing on lifestyle modulation with clinical support for lifestyle diseases, minimizing the need for medication and surgery. Another important thing every patient should understand is the patient's role in drug pollution. Major part of the medications we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us humans but also to all life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle disease and come out of medications to protect our children, grandchildren and the coming generations from ill effects of toxic pharmaceutical pollution. We should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on reversing lifestyle disease and minimizing medication is the need of the hour. Therefore, remember to share this to your relatives, friends and colleagues who are on chronic medication or planning surgery for lifestyle disease. Thank you.